One of the key challenges that we're seeing today has to do with the impact of change on the workforce. With the unemployment rate at an all-time low, it really hits hard in healthcare and really hits hard in senior care. So I've been in this space for 30 years, and I continue to see the impact of change around regulatory changes, policy changes, and the emphasis on data. How much data is being used to really write the story of that nursing home facility. PrimeCare Technologies has really taken an approach from a platform perspective towards solving some of these problems that we see in that space today. Again, the data has gone well beyond the electronic health record, and our platform and our business intelligence platform, the primeVIEW dashboard, really sought to integrate that data in a meaningful way. When we think about technology and how we're going to build it as a tool, we know we want to build it to bring maximum efficiency to the end user. And that end user could be a nursing assistant who's holding our app and assisting a resident to call home, or that end user could be a regional who needs to get a handle on census and financials and overtime and labor. We're trying to build a tool that really makes our workforce members more efficient, kind of solve their problems, make it easier to do this very, very hard job that they're trying, to do in that post-acute space. As a practical daily challenge, directors of nurses and staffing coordinators are trying to staff to a budget, they're trying to staff to census, but they have to be mindful of how their staffing is going to show up in 5-star. So we built a tool that really did the calculations for them. We had their data, we had their labor information, we had their acuity. We could actually show that end user in a very easy, simple screen. Here's how you're going to look in 5-star if you continue to staff as you have been for the quarter with today's census or with your average daily census. But instead of just sort of randomly changing staffing, they could literally be strategic and know that if they change staffing in just a small way, they would still fall within maybe their 4-star distribution. And now we gave them a screen that in seconds, they know the answer to the decisions that they make. And so those are the kinds of solutions that we want to build. One of the most important values that technology can deliver for the skilled workforce is a return on their investment. And best-in-class technology is going to deliver a return on investment from an efficiency perspective for the workforce members, as well as some of those harder return on investments, dollars, value, metrics that your CFO and your C-suite really come to expect. Every day when I'm thinking about what we're going to build at PrimeCare Technologies and how we can offer a platform of services to our partners, we're thinking about those kinds of returns on investment. So I know we're doing the right thing when we're delivering time back to caregivers and valuable metrics, and sometimes, again, it's a hard dollar ROI that we can return back to our trusted vendor partners.